Yeah.
What did you go in for?
I felt like I was having really bad chest pain and having a pain in my left arm.
Okay.
And I felt like I was gonna pass out, like all the time.
Yeah.
And, it wouldn't go away, so I went to the ER.
Okay.
Yeah.
And what did they tell you?
They said I didn't have a heart attack, but they said that there could be something wrong with my heart.
And is this the same sort of pain that you've had in the past, or is it a completely new type of feeling?
It's same type of pain.
And have you gone to the ED every single time for this type of pain?
No.
Okay. And so this one was persistent, and that's why you went to the ED.
Well, I just felt like I'd never felt like that before. I felt like I was gonna pass out, and it felt it just it just wouldn't go away, and it hurt really bad.
They in their note had said that you might benefit from something called a Holter monitor. Did they tell you about that?
No.
Okay. The Holter monitor is basically a monitor that monitors your heart rate. And I think that, so how often are you having these episodes where you're having chest pain?
Yesterday I had one like all day.
How often, like how many times in a week would you say you have it?
Like maybe twice a day, all week.
Okay. So I think we should just rule out any sort of like heart rhythm abnormality with this monitor.
Okay.
I don't suspect that that's the issue because your heart rates have been totally normal when you've been here, but we can just rule it out as a cause.
Okay.
Does that sound good?
Yeah.
What else do you want to talk about today?
Well, so I asked Dr. I think it's Dr. Bailey, to do a CD4 panel on me, and I looked at it and I didn't really know how to interpret it.
Yeah.
It said it was at 641.
That's normal.
That's normal?
Yeah. So your CD4 count was normal.
So would that indicate I did not have like AIDS, or could I still have AIDS, or how would that work?
It indicates that you do not have it.
Couldn't possibly have it?
Couldn't possibly have it.
So I got it tested the next day.
Okay.
And it said it was at 1,164.
What do you mean you got it tested the next day?
I paid for a test online.
Oh. Okay.
And it seemed like it had fluctuated a lot.
And that's normal. Sometimes it does fluctuate, but when we worry about it is when it's below a certain number, and you're not even close.
Okay.
Yeah. So below like 50 or 100.
Okay.
Yeah.
So does HIV, does it do anything other than attacking the CD4 blood cells?
That's how we monitor it.
But yeah.
So that's like the surefire way to diagnose it.
Okay, but it does probably do other things to the body?
Yeah, it does other systemic things, like it gives you feelings of fatigue and that kind of stuff. I've never heard of it giving you chest pain like you're feeling.
Okay. Well, I think I've recently lost like a lot of weight.
How much weight?
At least 10 pounds.
Okay. How long?
In a month.
Okay.
It has started happening like the 14th of October. And it's all muscle too.
Have you been working out?
Yeah, I've been trying to.
Okay. Where are you getting the number of the 10? from?
Weighing myself at home.
Okay. The weights we have in clinic, like normally, based on what type of time of day it was and stuff, can fluctuate between like half or 1 kilo, which is like a pound or 2. And so what I'm seeing is that the highest weight that we got you at was 95 kilos in May, and now you're 90 kilos. That because of your exercise, that doesn't really surprise me.
My exercise? No, I'm losing, like I've lost a lot of muscle, and my muscles are always tired, and I've lost like a ton of muscle, like my arm looks like a stick, and then in my legs, I lost a lot of muscle in my legs, like I lost a lot of weight, and it's all been muscle.
Okay.
Like it's really disturbing.
How's your eating?
I've been making myself eat. I lost my appetite in like October, and my appetite just like disappeared, it just went away. And so I wasn't eating very much, but then I've been making myself eat. So I make myself eat at least twice a day, and I try to eat a lot, but I'm still losing weight.
What do you eat twice a day? Like what kind of food?
I go to Amazon Go, I eat sandwiches, maybe get a cookie, I eat pizza there, quiche. I was at my mom's house the other day, I ate dinner she made.
Yeah.
I eat eggs, like hard-boiled eggs. I eat like 6-8 eggs.
Yeah. But maximum twice a day?
Yeah. Well, no. I mean, sometimes more, sometimes 3 times a day. I try to eat whenever I feel my stomach feels empty. But I'm eating a lot. And I just would say like this weight loss is really abnormal for me. And I've also been having like a lot of fatigue, like really feeling really, really tired.
The fatigue isn't new for you since October though.
No.
Okay.
Yeah.
Fatigue is kind of an always thing.
Yeah.
Okay. And then you're still taking your Diodon, correct?
Yeah.
Okay. And still doing okay with it?
Yeah.
Okay. That medication can sometimes change muscle into fat or like increase the fat production.
I've been on it for like a year. It's never done that.
And so, but we did increase your dose this year. Like we've gone from like 20 to 60 to 80.
No, I just take 80 at night. That's it.
Okay. You've never been on a lower dose before?
No, I've always been on just 80.
Okay.
80 at night.
Okay. And so what are you concerned about that's going on?
Well, the weight loss.
Yeah,
the weight loss is really that I have cachexia. I'm losing like muscle mass.
Okay.
That indicates a serious problem. I mean, I'm not just saying it's AIDS. It could be leukemia or heart failure, but it's a serious problem. I'm losing a lot of muscle.
What are you most concerned about it being?
Well, what am I most? I don't know what it is.
Okay.
But I mean, I was thinking it was AIDS.
Yeah. Which it's not. We've ruled that out.
Well, can I say something?
Yeah.
So I was drinking a lot during the course. I recall my lymphocytes were down in June. I think you told me that.
Oh, really? In June, you said?
Yeah, June 28th.
Your lymphocytes?
Yeah.
Have been normal for 6 years. So 6 years, 1 year ago, 4 months ago, 1 month ago.
Is that the June 28th lab?
That was of this year, correct?
Yeah.
That's this one. 4 months.
That's not. Is that? That's October. That's October 5th.
I know that was a month ago, and you can see all of the previous labs.
Yeah, but I'm talking about the June 28th.
I know, that's this one. But here, I'll show you.
That's at 15%. That's low.
Mm-mm.
Well, the standard range is 20 to 40%.
For lymphocytes.
Yeah, so 15 is below 20.
So what we care about is that the ratio between the two is about like 10 to 20%, and then 70% for the other one, and that's normal.
The thing is, I was drinking a lot during the course while I was feeling like sick, like I had HIV, and I think it might have. I was talking to the nursing department where I work, and they said that drinking can kind of accelerate the course of HIV because drinking suppresses the immune system, and I think that's what kind of happened to me.
Okay, but
Yeah.
you don't have HIV.
Well, I'm just not. I don't think my body's producing antibodies.
I think it is. Your white count is normal. If you had something like leukemia, you would notice that the white blood cell counts were really low.
Well, I'm talking about HIV.
And HIV would be the same thing. HIV is off the table. We've ruled it out several times, and we got a CD4 count. It's off the table.
What do you mean off the table? I mean, I'm I'm not trying to bargain here. I'm trying to figure out what's going wrong with me. Don't you think the fact that I've lost a lot of weight and it's all been muscle, don't you think that's a concern?
Sure, but I don't think it's HIV.
Okay, well, it's not HIV, but it's something.
Okay. I'm worried that it's stress.
It's not stress. I mean, I don't think stress is going to cause me to lose skeletal muscle. No, that's, I mean, if I were just, that's not, that doesn't sound right at all.
Why
that I would lose muscle mass from stress.
Yes. Stress can suppress your immune response too. Stress can change your body in many different ways. I think you've been so stressed out about this diagnosis and trying to figure out something's wrong when we've tried to prove to you that like your labs are okay and it's not HIV, that you've just stressed out your body a lot during this time.
No, I have like, I would like to see, if you, I think I should see like another doctor, like a specialist.
What kind of specialist?
Like an internist.
Okay. Internists aren't specialists.
Well, I think I should see someone that can try to figure out, why I'm losing weight.
Okay. But do you hear me when I say that your labs, the first things that we would do to test to see if there's something wrong, all look normal? Can we agree on that?
I mean, I have other things too. Like I have like these skin infections that won't go away. That clearly indicates some kind of immune problem.
People get skin infections. But let me see your skin infections. Show me what you're talking about. What?
Why do you want to see my skin infection?
Because you just told me you have a skin infection.
Are you going to tell me it's not there? Is that why?
No, I just want to look at it.
It won't go away. It's been there a week and a half.
Okay. And are you like the redness is what you're noticing?
It's right there. Yeah.
What is it that you're seeing? Describe to me what you're seeing and what's better and what's worse.
It's right there. It's a staph infection.
Okay. I'm not seeing anything that calls out a staph infection right there.
I had a staph infection on my wrist for like 2 weeks. Were you like? I'd like to get a. I told you, like, there's something seriously going wrong with me. I wouldn't go to the ER for no reason. I think whatever's causing me to lose weight is putting strain on my heart.
What I'm most concerned about is that this stress means that we're not adequately controlling your mental health. All of these symptoms that you're experiencing, I just want to rule out that your mental health is not a cause of it, and that's why I really want you to see a therapist and a psychiatrist.
So, I'm seeing a therapist and a psychiatrist.
Okay. What therapist are you seeing?
Claire Pastor.
Okay. How long have you been seeing her?
Just one session.
Okay. And how long ago was that?
Last week.
Okay. How did it go?
It went fine.
Where does Claire work?
Downtown Seattle.
Okay. And then what about the psychiatrist?
She is a psychiatrist.
Oh, Claire Pastor is a psychiatrist?
Yeah.
Or a therapist?
She is a psychiatrist.
Okay. So have you...
So I have something seriously physically wrong with me. I'm losing weight. I need to see an internist. I need to see a doctor to do tests. Don't you get that? I mean, are you a doctor?
I am a doctor.
So, like, do you not get I'm losing weight and
I believe
I'm losing skeletal muscle mass? I mean, that's something seriously bad. I'm, like, dying. Like, you understand that?
I don't think you're dying.
No, that's my prognosis is, like, really bad.
Why do you think that?
Because I'm losing skeletal muscle mass. I'm losing weight. And I'm really tired. Are you gonna stay, like, why are you staring at me?
I'm waiting for you to say what you're most concerned about. Are you concerned about cancer?
It could be cancer, yeah.
Okay, well.
Could be heart failure.
Okay, it's not heart failure.
How do you know it's not heart failure?
We would have noticed it by your labs already. And we've done extensive labs.
You don't think there's anything wrong with my heart?
I don't think so.
I want to see another doctor. I'm not going to leave here unless you get me another doctor. And I want a viral load test too. For HIV.
If your HIV was positive, it would have reflexed to a viral load.
Well, you're just giving me antibody tests.
If your HIV test was positive, it would have reflexed to a viral load. But it wasn't positive.
Because I'm not producing antibodies, because I've been drinking.
You're producing antibodies. Your white count is normal.
Not to HIV.
I don't know what you mean.
I'm not producing antibodies to HIV. Can you just give me a viral load test?
No, I don't think it's appropriate. We've done a lot of lab tests and proven that your HIV is negative.
Why am I losing weight then?
Because I think you're stressed about this.
Stress wouldn't cause me to lose skeletal muscle mass.
Yes, it does.
No, it wouldn't.
Yes, it does.
Okay, well, I'm going to remember that you told me that.
Okay.
Because that doesn't make any sense.
Okay.
It wouldn't cause me to lose, like, I've been working out, the muscles aren't coming back. It doesn't make any sense.
Do you want me to just keep repeating what I was saying?
I want to see an internist.
You can see whatever doctor you want to see.
I want a referral.
You don't need a referral.
Yes, I do. To get in, yes, I do. I do need a referral.
An internist is a primary care provider. You're saying that you want to switch primary care providers.
Why won't you treat me? I don't understand. What did I do to you? What did I do to you?
Treat you for what? I haven't found
Weight
anything
loss,
positive.
fatigue.
What do you want me to treat you for?
Weight loss, fatigue.
We've ruled out
skin
anything
rashes,
that I
skin
could-
infections.
We've ruled out anything I can treat you for.
No, you haven't. You haven't ruled anything out.
We've done labs for the last, year on you. Extensively.
So you just won't do anything.
I have nothing to do for you. I'm going to talk to your psychiatrist that you said that you just saw and see what her thoughts are.
Why? I don't need mental health treatment. I have something physically wrong with me. Are you a doctor?
Yes.
Then don't you take an oath to treat people who are sick? I mean,
And we
isn't that your
haven't found
responsibility?
anything to treat.
Isn't that your? I'm telling you, I'm having extreme symptoms. My family knows I'm sick. Like, they can tell that I'm sick. Like, I don't understand.
I think you are sick. I think you need more mental health support.
I'm not mentally sick. I have something physically wrong with me.
Well, then,
I felt sick for months. I mean, you won't do any more tests to figure out why I'm not getting nutrition or why my body's not processing food like it should.
I don't have any.
They told me at the ER you need to do a workup for this.
The ER unfortunately doesn't have the privilege of looking at previous labs beforehand, but you have had a workup.
What did I do to you? I don't understand. You just won't treat me.
I'm trying to be honest with you.
No, what did I do to you? I've not done anything wrong to any of the staff here. I don't understand. Why are you doing this to me?
I haven't treated you.
Oh my god!
Fucking asshole! You're out of your mind.
Help!
You're out of your fucking mind.
Help! Sit down, please.
You're out of your fucking mind.
Help!
You're fucking evil.
Help! Sit down. I need you to sit down, David.
You won't fucking. I come in here for months.
I need you.
I come in here for months.
I need you to calm down and sit down. David, I need you to calm down and sit down. I need you to calm down and sit down, please. I'm gonna have to go get security. Right now. Please sit down. David, you're scaring me. Please sit down. Please sit down.
I'm the one fucking dying here. I'm scaring you.
You just hurt me really bad. You just threw your notebook at my chest, and that was inappropriate. Please sit down. You're free to walk out. Go ahead.
You're beyond evil.
Okay.
You're beyond evil. There's no reasoning with me.
Step away. You're scaring me and I need you to go.